Human immunodeficiency virus, or HIV, is a virus that attacks the body's immune system. It is a serious condition that, if left untreated, can lead to significant health complications. HIV is primarily transmitted through contact with certain body fluids from a person who has HIV. These fluids include blood, semen, vaginal fluids, rectal fluids, and breast milk. The most common ways HIV is spread are through unprotected sexual contact, sharing needles, and from mother to child during childbirth or breastfeeding. The immune system is our body's natural defense mechanism, protecting us from infections and diseases. It is composed of various cells and organs that work together to identify and destroy harmful pathogens. When functioning properly, the immune system can effectively combat viruses, bacteria, and other foreign invaders that threaten our health. HIV specifically targets and weakens a type of white blood cell called CD4+ T cells, also known as T helper cells. These cells are essential for the immune system because they send signals to other types of immune cells, including CD8+ T cells, which destroy infected cells, and B cells, which produce antibodies. By attacking CD4+ T cells, HIV disrupts the entire immune response. These cells play a crucial role in coordinating the immune response. They act as the generals of the immune system, directing other cells to respond to infections. Without a sufficient number of CD4+ T cells, the body becomes vulnerable to a wide range of infections and diseases that it would normally be able to fend off. As HIV multiplies, it gradually destroys CD4+ T cells, weakening the immune system's ability to fight off infections. This process can take several years, during which an individual may not show any symptoms. However, as the number of CD4+ T cells decreases, the immune system becomes increasingly compromised, leading to more frequent and severe infections. Without treatment, HIV can progress to acquired immunodeficiency syndrome, or AIDS. AIDS is the final stage of HIV infection, characterized by a severely weakened immune system. At this stage, the body can no longer defend itself against opportunistic infections and certain types of cancer that are rare in people with healthy immune systems. AIDS is the most advanced stage of HIV infection, where the immune system is severely compromised, making the body susceptible to a wide range of opportunistic infections and cancers. These infections and cancers can be life-threatening and require immediate medical attention. Common opportunistic infections include tuberculosis, pneumonia, and certain fungal infections. Early detection and treatment are critical in managing HIV and preventing its progression to AIDS. Antiretroviral therapy, ART, is the standard treatment for HIV and involves taking a combination of HIV medicines every day. ART helps reduce the viral load in the body, maintain a healthy level of CD4+ T cells, and prevent the transmission of HIV to others. With proper medical care, people living with HIV can lead long and healthy lives. Advances in HIV treatment have transformed what was once a fatal diagnosis into a manageable chronic condition. Regular medical checkups, adherence to medication, and a healthy lifestyle are key components in ensuring a good quality of life for those living with HIV. Knowing your HIV status is a crucial step in taking control of your health and well-being. It empowers you with the knowledge you need to make informed decisions about your lifestyle and healthcare. It's the first step towards protecting your health and the health of your loved ones. By knowing your status, you can take the necessary precautions to prevent the spread of HIV and ensure that you and those around you remain healthy. Regular testing is a responsible and caring act, showing that you value not only your own health, but also the well-being of your family and friends. It fosters a supportive environment where everyone can feel safe and cared for. HIV testing is simple, confidential, and readily available. You can get tested at various healthcare facilities, community centers, and even at home with self-testing kits. The process is designed to be as convenient and stress-free as possible. Antibody tests are the most common type of HIV test. These tests are highly effective and can provide results in a short amount of time, often within minutes if using a rapid test. They detect the presence of antibodies, which are proteins produced by the immune system in response to HIV infection. This means that if you have been exposed to HIV, your body will produce these antibodies, which the test can then identify. These tests are typically performed using blood or oral fluid samples. Blood samples are often taken from a finger prick or a vein, while oral fluid samples are collected using a swab from the inside of your mouth. Antigen antibody tests can detect both HIV antibodies and antigens, which are foreign substances that trigger an immune response. This type of test can identify an HIV infection earlier than antibody-only tests because it detects the virus itself, not just the body's response to it. These tests offer a wider window of detection compared to antibody-only tests, making them a valuable tool in early diagnosis and treatment. Nucleic acid tests, or NATs, detect the presence of HIV RNA, the virus's genetic material, in the blood. This type of test is particularly useful for detecting HIV in its very early stages, even before antibodies or antigens are present. NATs are highly accurate and can detect HIV infection earlier than antibody or antigen antibody tests. Early detection is crucial for starting treatment as soon as possible, which can significantly improve health outcomes and reduce the risk of transmitting the virus to others. Swollen feet, also known as edema, can be a symptom of various underlying health conditions, ranging from minor issues to more serious health concerns. Edema occurs when excess fluid gets trapped in the body's tissues, causing swelling and discomfort. This condition can affect any part of the body but is most commonly seen in the feet, ankles, and legs due to gravity pulling the fluid downwards. In some cases, edema may be linked to HIV, a virus that attacks the body's immune system. HIV, or human immunodeficiency virus, is primarily known for its impact on the immune system, but it can also lead to a variety of other health complications. While HIV itself doesn't directly cause swollen feet, it can lead to complications that manifest as this symptom. The virus weakens the immune system, making the body more susceptible to infections and diseases that can affect various organs and systems. HIV weakens the immune system, making the body more susceptible to infections and diseases that can affect various organs, including the kidneys, heart, liver, and lymphatic system. These organs play crucial roles in maintaining the body's fluid balance and overall health. When these organs are compromised, it can disrupt the body's ability to manage fluids properly, leading to fluid retention and swelling in the extremities, such as the feet. For instance, kidney disease can result in the body retaining more sodium and water, causing edema. These complications can disrupt the body's fluid balance, leading to fluid retention and swelling in the extremities, such as the feet. Additionally, heart problems can cause blood to back up in the veins, leading to swelling in the lower parts of the body. It's important to note that swollen feet are not always a cause for concern. Sometimes it can be due to prolonged standing, sitting, or even certain medications. However, persistent or severe swelling should not be ignored. However, if the swelling is persistent, severe, or accompanied by other symptoms such as pain, redness, or difficulty breathing, it's crucial to seek medical attention to determine the underlying cause and receive appropriate treatment. Early diagnosis and intervention can prevent further complications and improve quality of life. Consulting with a healthcare professional can help identify the root cause of the swelling and guide you towards the best course of action. Whether it's adjusting medications, treating an underlying condition, or making lifestyle changes, proper medical advice is essential for managing edema effectively. HIV-associated nephropathy, or HIV, is a type of kidney disease that can occur in people living with HIV. The kidneys play a vital role in filtering waste products and excess fluid from the blood. When the kidneys are damaged, they may not function properly, leading to fluid retention and swelling in the body, including the feet. HIV is more common in people with advanced HIV infection and low CD4+ T cell counts. Other risk factors include African American or Hispanic ethnicity, high blood pressure, and diabetes. Early diagnosis and treatment of HIV are crucial in preventing further kidney damage. Treatment typically involves antiretroviral therapy to suppress HIV replication and medications to control blood pressure and reduce protein in the urine. Section 5. Antiretroviral therapy, a balancing act. Antiretroviral therapy, or RT, is a cornerstone of HIV treatment. ART involves taking a combination of medications that work together to suppress HIV replication, prevent damage to the immune system, and slow the progression of the disease. While ART is highly effective in managing HIV, some antiretroviral medications can have side effects, including fluid retention and swelling. This is because certain medications can affect the kidney's ability to regulate fluid balance. It's important to discuss any side effects you experience with your healthcare provider. They may adjust your medication regimen or recommend ways to manage side effects, such as dietary changes or medications to reduce fluid retention. Section 6. Opportunistic infections, the threat to weakened immunity. Opportunistic infections, or OIs, are infections that occur more frequently or are more severe in people with weakened immune systems, such as those living with HIV. Certain OIs can cause inflammation and swelling in the feet. Cellulitis, a bacterial skin infection, can cause redness, swelling, and pain in the affected area, including the feet. Other OIs, such as fungal infections or mycobacterial infections, can also lead to foot swelling. These infections may directly affect the feet or cause systemic inflammation that contributes to fluid retention. Section 7. Heart, liver, and lymphatic system, the domino effect. HIV and its complications can also affect other organs, such as the heart, liver, and lymphatic system, which can indirectly contribute to foot swelling. Heart failure, a condition in which the heart cannot pump blood effectively, can lead to fluid buildup in the lungs and extremities, including the feet. Liver disease, which can result from HIV infection or certain medications, can impair the liver's ability to produce proteins that help regulate fluid balance, leading to fluid retention. The lymphatic system, a network of vessels and tissues that helps remove waste and excess fluid from the body, can also be affected by HIV. Damage to the lymphatic system can disrupt fluid drainage, causing swelling in the extremities. Section 8. Recognizing the warning signs. When to seek help. It's important to be aware of the potential link between HIV and swollen feet, and to seek medical attention if you experience this symptom, especially if it's persistent, severe, or accompanied by other symptoms. Seek immediate medical attention if you experience any of the following: sudden onset of swelling, pain, redness, or warmth in the affected foot, shortness of breath, chest pain, confusion, or difficulty speaking. These symptoms could indicate a serious medical condition that requires prompt treatment. Early diagnosis and treatment can help prevent complications and improve outcomes. Section 9. Your health, your priority, take charge today. HIV is a manageable chronic condition, and early detection and treatment are crucial for maintaining a good quality of life. If you are concerned about HIV or swollen feet, don't hesitate to talk to your healthcare provider. They can provide personalized advice, testing, and treatment options tailored to your individual needs. Remember, taking care of your health is an investment in your future.